Joining me is Dr. Peter Shaw, and Dr. Shaw is a deputy director of Cancer and Blood Disorders, Blood Disorder Institute, and you have an interesting story behind why you decided to become a doctor, and particularly a pediatric cancer doctor. Can you kind of go into what drew you to that, and how you've become the new sheriff in town here?
Sure.
At All Children's?
Well, during my medical training, I knew I always wanted to do something with children. I was a camp counselor, and I volunteered at a pediatric rehab hospital during summers during college, and then just really liked the hematology side of things, looking at blood under the microscope, the geekier side of me.
Right.
And then once I started to take care of patients hands-on, the patients that I was drawn to in the pediatric world were always those with cancer or those with blood disorders. Those are the families and the kids I bonded with, the diseases I found the most interesting.
Okay.
So I just kind of found my path, and then did my residency for 3 years in New York, moved on to fellowship training in Chicago, and then after 16 years of being in Children's Hospital Pittsburgh, I was very happy to have an opportunity to come here and lead the institute here, and continue to improve care for all the patients seen in the hospital.
So, having been in the children's healthcare field as long as you have, how would you? I don't want to use the word rate. I don't want to use something like that. But how do you scale All Children's Hospital here, Johns Hopkins All Children's Hospital here, to maybe some of the other places that you've worked at?
I mean, the facility is 5 years old. It's absolutely beautiful. The physicians, the nurses, the other staff are all top-notch. What really drew me here, I came from a great hospital. What drew me here is this is a hospital that's great, but is going to get better. This is a hospital on a huge upswing. With the partnership with Johns Hopkins Medical School becoming one entity over the last 5 years, it's really infused the whole hospital with a new enthusiasm and real academic mission to raise the bar when it comes to research and patient care and new experimental initiatives to just improve the care to the kids in the region. Because it was always a great hospital for patient care, but now it's going to another level. So I wanted to be on board and help the hospital get to the next level to really be a top-tier children's hospital nationally and even have an international reputation. And I think we're definitely well poised to do that in the region and even on the national and international scene. So it's an exciting time to be here.
It's one of the things I mentioned, the money that we raise over the course of these 2 days, a lot, it goes to a lot of different things, but research and education are two of, I would say, in my opinion, the most important things that we need to continue to do. Mm-hmm. Like yesterday, I talked to a couple, and I'd have to go back and look at the notes, and I can't remember exactly what it was called. But Dr. Kays was here, and he specializes in when a child's diaphragm doesn't develop, and basically all their internal organs go into their chest.
Right.
And there's a very small survival rate with that before Dr. Kays started doing some research and education and everything else, and now he's got, at All Children's Hospital, he has a 100% survival rate, where before it was like 45. So the things like that, the research and education that you were talking about, showing doctors how to do, these new things is just going to make, kids, their survival rate even better.
I agree. I mean, he's a great pioneer in that field, and pediatric cancer research specifically has really moved the needle and raised pediatric cancer cure rates overall from what had been 10 to 20% in the early 70s to close to 90% across the board.
It's really, really impressive.
So,
do you have any of your patients here at All Children's who have had or have, and I may mess it up, Osteo Sarcoma?
Yes, we take care of. That's the most common bone tumor we see in kids and young adults.
So do you know Austin Dodd and Marina Petty?
I think I've met them. I've met a bunch.
They were here yesterday.
I've only been here a few months.
Yeah.
I've met them. I've definitely heard about them, but I've met a handful of our patients, take care of them as I've started to get more involved in patient care.
Two really neat kids. They're older. They're both 17, and they're up there and they're bored, and and they know that the little kids that are up there, are just kind of restless and scared. So they would go around to other kids' rooms and talk to them, and do arts and crafts with them, and they ended up having throwing pizza parties and stuff like that. So I thought that those kids were really neat. And another kid that I'm going to talk to here in a little bit has it also, Jackson Carter, who's 11. Something that I think a lot of people don't realize is we talk a lot about the younger kids, the babies, and the 4 and 5 year olds, the leukemia patients and everything else. But sometimes the 17, the 16, 17, 18 year olds kind of get lost in the shuffle by the little kids. And I've heard, and I was reading that you kind of like going towards where those kids are and helping them out, not anymore, but just showing them a little bit of extra something.
Right. Well, where I was, I started an adolescent young adult oncology program to focus on both the clinical care that those 15 to 22-year-olds get, but also the psychosocial support they get.
Yes.
So, and that's something I want to carry over here. It's something that some of my colleagues are already doing here, but I want to help expand that really to have maybe some teen and young adult trips. We used to do ski trips, which is a little harder to coordinate when you're down in Tampa and St. Pete. Unless
ski.
we do water skiing trips. But I mean, something like that, outings so that we create long-lasting bonds between the young adult patients so they have a sense of connection with peers that are going through what they're going through.
Fishing trips would be really cool.
Exactly, yeah, that's something I've got to get acclimated to.
And you can do flats fishing. You can go out a couple of miles. and everything else.
Sign me up. I'm ready to catch
It's
some.
fun.
I'll catch some snook.
It's fun. Flats fishing is probably one of the best kind of fishing I've ever done. Until I went out with a guide and he said, well, "What do you want to catch?" And I'm like, "I've heard tarpon are fun." He goes, "Oh, okay. Once you catch a tarpon, you don't ever want to fish for anything else. It's like catching a 7-foot-long largemouth bass. It's the most fun thing." Okay, we're getting completely off subject, but anyway,
I'm getting excited. I'm gonna go fishing this week.
there are plenty of them right out your window. So, how does working at All Children's help impact your relationship with your own kids?
Well, I've always, it definitely does change your approach as a pediatrician, having your own children. And I have 3 amazing kids that are 17, 14, and 10 that are getting acclimated to, they're liking the move a lot more now that the weather's good and they're friends
long
in
have you lived
Pittsburgh, 4 months now.
You got to give everything a year.
They're liking the climate definitely, and they're making new friends, so they're great. But it does give me, back to like the medical side, having your own children definitely gives you, I think, a unique perspective. It puts everything in perspective in that I don't get too flustered about day-to-day ups and downs. Just because of knowing what my patients and their families are dealing with on a minute-to-minute basis. So if I get a flat tire, that is
not a big deal.
That is a speck of sand compared to what families are going through on a day-to-day basis in the clinic or at home that we don't even, when we're not even seeing them, or in the hospital. So I think I'm blessed with that unique perspective because I've taken care of some very, very ill children, very special children with very, amazing families who've had to deal with problems. And just, so that gives me the perspective. And also, I think I take flack from my wife for sometimes poo-pooing some of my own kids' illnesses. If one of my kids is sick, she's like, I know they don't have leukemia, but he doesn't feel good.
He's fine.
And I have to be, so I've been guilty of poo-pooing some of my own child's illnesses. Thankfully, overall, not
that's terrible and hilarious at the same time.
They're quite healthy. Thankfully, they're quite healthy. But I'm able to go home and have these healthy kids. So I don't mind them giving me a hard time, making them feel like I don't know anything when I get home. It really keeps me balanced, having a very supportive family, an amazing wife.
That is good.
And 3 kids, and the dog is always happy to see me too.
Oh, yes, it's a great thing about the dog.
That's something that I can always rely on after a long day. The dog will be happy to see me.
The consistency of the dog is always fantastic. You say that, and my wife and I have done the same thing. We'll get so bent out of shape about something so little, and either one of us will look at the other one and go, "Everybody's healthy."
Exactly. It does.
And it just brings it right back to center. You're right. Everybody's healthy. That on the floor really isn't that big of a deal.
Right. Yeah. When we got a new house and a lot of things have gone wrong, I fell through the ceiling and all those things, and everything's in perspective. I survived.
Yeah. I put my foot through the ceiling.
Everything is in perspective. I came all the way through.
Did you?
Yeah. Right into my son's bedroom, and
did you land on the bed at least, like a
I
Christmas
caught myself
vacation?
on a beam, and he was still sitting in bed and looked up at me and just said, "Hey, Dad, what's going on?"
Oh, that's so funny.
So
are you all right?
Yeah, to everybody. So everything is all relative. So I think
is.
having that balance in my life has really helped me keep things in perspective, and then also having amazing colleagues here who you can always bounce things off of. It's a very supportive family type environment within the Cancer and Blood Disorders Institute. I didn't come here for the weather. I came here because of the job opportunity and the people. Everyone I met on my when I came down to visit, I was very impressed with just the quality of people and their dedication to the children, and always putting the children and their families number one, going above and beyond what I've seen other people do. So the people is really what makes it. The building's beautiful, but it's the people that makes this place really tick.
Well, like I was telling you before, this is I believe our 5th year in the new hospital, and we did the first 3 radiothons in the old hospital. And I agree, and the reason I say this is I agree with you, because the people that I've met in the last 9 years in this, it doesn't matter if it's this building or the old building or a shed out back, they are the most amazing people you'll ever want to meet in your life. The kids are first. Let's get it taken care of. We'll worry about the other stuff later. And it's all about the kids, and they're all super nice and well educated and fantastic. So you're 100% right, and you definitely made a good move.
I'm very happy with my move. Every day I'm happy to come to work and work with everybody around me. It's really a great environment.
Awesome. Anything else you wanted to say, Dr. Peter Shaw, before we wrap it up?
No, I mean, this is an amazing hospital. Please support it. We have so many great services. We were talking about pets. We have pet therapy dogs here that are very therapeutic. You've probably seen them before.
Music therapy was
Music
another
therapy
one
is
too.
wonderful.
Awesome.
I mean, there's so much stuff that you get at a children's hospital you don't get in an adult hospital. Art therapy, music therapy, pet therapy, this great auditorium where there are a lot of great activities Child Life does. And all of that just makes the stay here easier on families.
Agreed.
And patients. And that's, I mean, our job is to keep them out of the hospital, but if they're here, make it as pleasant as possible while they're here.
Absolutely. Dr. Shaw, thank you so much for taking the time to come down here and talk to us. Round of applause for Dr. Shaw.
You're welcome.
1-800-270-8642 is the phone number, 1-800-270-8642. Make that phone call. Become our monthly miracle maker. $15 a month. It's very simple to do, and it'll make you feel real, real good. We'll be back in a little bit. We're live from Johns Hopkins All Children's Hospital in St. Pete.